Now, thank you. I'll ask you to assume that the oncologist prescribed an antibiotic known as clindamycin. And I'd also ask you to assume that Mr. Harper was allergic to penicillin. First of all, tell us what clindamycin is and what it's used for.
Clindamycin is an antibiotic that's effective against bacteria that inhabit the mouth, and it is either first or second choice for treating infections that occur in or around the mouth of the jaw. Some people prefer penicillin, often together with clavulanic acid. That's called amoxicillin, which I'm sure people here have heard of. And if someone who's allergic to penicillin, you can't prescribe amoxicillin, so there really is not much other choice. And clindamycin is a good, effective drug. That's what many people would prescribe.
In a man with myelodysplasia and in swelling and pain under his jaw and on the right side of his neck, would that be consistent with an ongoing infectious process in that area?
Yes, sir.
The jury has turned the term empiric treatment or empiric antibiotic treatment. Explain what that means, please.
Well, when a patient's, first of all, empiric means that we don't know exactly what the cause is. And sometimes it's because you just can't find out what the cause is. So, for example, in this patient who has an infection under the jaw, unless you literally make an incision and open up the tissues and do a culture, you can't find out exactly what bacteria are there. And I will point out, because it may come up later, that you can't make an incision and somebody's got platelets of 21,000, because you make an incision and he will just bleed and bleed and bleed. That's the problem. At any rate, based on the knowledge that infections in that area are caused by bacteria that are usually susceptible to clindamycin, prudent and a good physician will choose clindamycin for treatment. And that's what was done in this case, and that was entirely appropriate.
Are different types of bacteria commonly found in different areas of the body?
Of course.
Could you give an explanation of that?
Well, I can't explain it absolutely why, but I can explain that. We have certain bacteria that inhabit the mouth. There's streptococci and staphylococci and bacteroides. There's certain different families of organisms. And they're the ones that really are susceptible to clindamycin. Our intestines, especially the large bowel, the colon, tends to be inhabited by what they call gram-negative organisms like E. coli and Pseudomonas and Klebsiella. So the environment of the bowel is much more conducive to the growth of one set of organisms, and the environment of the mouth is conducive to the growth of another set of organisms.
Is Pseudomonas commonly found in the mouth or associated with head and neck infections?
No, sir.
Have you actually done a search into the world's literature to see if you can find reports of incidents of Pseudomonas infections in the neck?
I specifically did, and I did it, Mr. Green, as a result of the particular case of Mr. Harper. I went to what's called PubMed, which is the electronic search engine for all the medical literature, and I found just a few cases in the whole world literature of Pseudomonas causing this infection under the jaw. There's a name for this infection under the jaw. It's called Ludwig's angina. I don't know if that term has been introduced in this program yet. But anyway, that's what it's called. And only, I think it was 2 or 3 or 4 hits came up from all these millions of articles we published since goodness knows when, in which a Pseudomonas has been implicated in Ludwig's angina.
Now, Dr. Musher, assumed that the next day, October 18, 2006, Mr. Harper presented to the emergency department at Kempstone Hospital around 1:30 in the afternoon with continued swelling on the right side of his neck under his mandible or his lower jaw. and assume that blood was drawn by the physician there. Go to base 539, please. And evaluate it, and if you would go right here. And assume that this was a blood work which was drawn from Mr. Harper on the afternoon, about an hour after he was admitted on October 18, 2006. If you would explain to the jury the progression that this reflects from the blood work of the 13th, which was previously discharged, the 17th at his doctor's office, and the 18th.
Well, the folks don't have the left-hand column that says what's what, but I can show very briefly. Look, that's the white blood cell count.
Kevin, cover black hand, please. There we go. Okay. Now you can focus in on this.
Well, so we lost it again, but I believe that 1.9.
Just leave it up to the well.
That 1.9 is the white blood cell count, so it's gone from 2,900 to 2,100 to 1,900, falling. And once again, somebody had a bacterial infection. They expect to be rising because that's the way the body normally responds. A high white blood cell count is how you respond to a bacterial infection. And his platelet count is now,
Show off to the side, Kevin.
I believe that's the platelet count.
Okay, just leave it like that. Platelets are here.
What's the date?
This is October 18th at 2:37.
Yeah, okay, good. So you see his platelet count is now down to 21,000. I mean, that's just, when platelet counts get that low, people are just in danger of bleeding spontaneously.